Okay, so first video in this series, let's talk about board certification. What is a board certification and why does it matter? So the way medical training works is you go to medical school, either DO or MD, you finish medical school and you start some kind of training program. At least that's how it should be. So there's training programs in all different areas, and after you finish your training program, you sit for your boards. So depending on your specialty, your boards are either going to be a written board or a written plus an oral board. A written board, of course, is just an exam, which is exactly what it sounds like. You sit down and answer questions, and an oral board is where you sit in a room with some people grilling you with difficult questions. And the purpose of these board certifications is to assure that the physicians that went through residency programs acquired all of the knowledge they should have and appear to be safe practitioners before they're set free on the population. So in the 1930s, the American Board of Medical Specialties was founded, and this is an organization that represents the 24 what we call recognized boards in the United States. These boards include everything you're probably already familiar with: the American Board of Surgery, American Board of Pediatrics, American Board of Internal Medicine, American Board of Plastic Surgery, American Board of Ophthalmology, you name it, they're in there. So when it comes to cosmetic surgery, when you're looking at a surgeon's training, the recognized formal training programs that teach cosmetic procedures are going to be plastic surgery, where you learn plastic surgery of the whole body, cosmetic surgery of the whole body, facial plastic surgery, which is the face, and oculoplastic surgery, which is the orbit. Now, one of the issues in the world of cosmetic surgery is that it's very lucrative. And so there are people who unfortunately skip the recognized training programs and either do something else or nothing at all, which is really scary. There's people out there doing liposuction on patients and cosmetic procedures that are pediatricians. One was in an LA Times article this last year. People that just have a touch of surgery and a touch of psychiatry training. No formal finishing of any residency program that are doing surgery on patients. So hospitals and surgery center often require some kind of demonstration of training and competence. And so if you have privileges at a hospital, they typically require board certification by one of the American Board of Medical Specialties boards. So unfortunately, there are now multiple boards and training programs that are not recognized by the American Board of Medical Specialties that sound very similar to the recognized boards, and it can be very misleading to patients. For example, there's the American Board of Cosmetic Facial Surgery. There's the American Board of Cosmetic Surgery. And this sounds like one of the recognized boards, or similar enough that many people don't know the difference. There are some truth in advertising laws in states that prohibit people from advertising board certification in an area that is not recognized by the American Board of Medical Specialties. I am in hard agreement with those laws. We have those in California. So an easy way to check certification is to go to Certification Matters. And so this is a website that looks at all of the recognized boards of the American Board of Medical Specialty. So here's me, so you can put me in here, and I have 2 board certifications. I have plastic surgery because I completed a plastic surgery training program and sat for my boards, and also general surgery, the American Board of Surgery, because I also did that. So if you're having a cosmetic procedure, at a baseline, you want to make sure that your surgeon is licensed in your state and has done the proper training. So check their board certification. So in my comments, sometimes people will say that I saw a board certified plastic surgeon at one of these chain plastic surgery places that also employs not board certified plastic surgeons. And my response is always the same. If you think that's important for your safety and patient safety, why do you not want that for other people? And why would you support a company who doesn't have the same values as you? Every single patient should have the best possible care, and if you see a board-certified plastic surgeon because you think that's the best possible care, why are you okay with other people not having that care? And you shouldn't support a company that's okay with that, in my opinion. So does being board certified mean that you're going to be a great surgeon and an ethical person? No, of course not. There's been news stories that have shown that there's some crazy plastic surgeons out there, but it's your foundation. So the bare minimum you should expect from your doctor is the proper training, proper board certification. It's the bare minimum. And if they don't have that, why are you going to them? And I think if you're considering going to one of these non-plastic surgeons for a cosmetic procedure, ask yourself why that person didn't do plastic surgery. You know, they tried to fight in California that cosmetic surgery fellowships and board certification was equivalent, and they lost, and it was pretty clear it was not. So why do you think they didn't do it?